Good evening, everybody. Welcome to be with you here. I'm Dr. Sam Shamarty, speaking to you tonight from the West Coast in Southern California for our webinar topic tonight, and the modern advances in surgical dentistry from treatment to management. A couple side notes and background with the Q&A. Please feel free to submit any questions that you have. Upon ending this webinar that's scheduled for about an hour, I will stick around after to answer any and all questions and hopefully help clarify any points and questions that you might have. And I'll catch those as soon as we finish. Some background on my end. I am a practicing and board certified periodontist. Was in Boston for the better part of the last 22 years, but moved back home to my hometown of Southern California over the past few months. So continuing to practice here. Continuing my academic affiliations, teaching in the perio programs at both Harvard and UPenn, a medical director for the Medical Board of Nobel Biocare, and privileged enough to be in the Catapult Education Speaker Bureau, and author of the Financial Survival Guide for Dentists. All being to say, I've spent way too much time in the chair and had way too much exposure to a lot of these awesome technologies that I'm going to be speaking to everybody tonight. So what I'd really like to emphasize in our very short and very condensed and detailed section is that the main point of our area tonight is to really look at areas of surgical technology that not only have innovated and evolved over time, but continuously gotten better. And I think we're going to highlight a couple of these areas looking at high-speed technology, both air-driven and electric. We'll start looking at where size matters in terms of what we can do in pediatric and patients with small mouth and or TMJ issues. Then from the surgical side, we're going to look at some implant motor essentials, what makes some implant motors far more unique and advantageous to us from the clinician standpoint. Look at the piezo surgical characteristics as well. And last but not least, an overlooked but very critical area for non-surgical therapy versus airflow with airflow technology, and show you how that has evolved over time. So a lot of technologies that on ground level, foundationally, we're all pretty well familiar with, but again, the sheer amount of evolution that we've gotten over time is pretty vast. And so the applications that we have for them today are pretty unique. So we'll do our best in this very short time to jump through everything. So without further ado, I will jump right in. And again, when we talk about these modern advances, we're trying to apply them to everyday type of surgery. So whether it be for creating a sinus window, for doing an external sinus lift, whether it's for trying to deal and manage with peri-implant infections and complications, which we'll find later on, those percentages are growing staggeringly high, or even more customary day-to-day procedures like surgical extractions. What we'll find is that all of the different type of equipment and technology that we discuss come into play for some, in some cases, multiple of these different scenarios, and we'll see how things have evolved all over time. So with that being said, the first category that we want to highlight are evolutions in handpiece technology. We have come quite a long way from our traditional handpiece, and in terms of what it's been able to do and how much power it has as its characteristic. So we'll see how this technology has rapidly evolved and advanced just in the past year alone. As a background, speaking of Viva Learning, who's gracious enough to be hosting us, this was a topic of a podcast a couple years back talking about some of these advancements. But as I said, this field has advanced drastically. And even though this was just a little bit over 3 years ago, some of the advancements I'm going to talk about have come in less than the past year. So even that podcast a few years ago would be considered outdated for today. So just to highlight how much things have been passing by and growing rapidly. So one of the things we'll talk about is our traditional air-driven handpiece, still kind of the bread and butter for most clinicians. Its claim to fame is speed. What makes an air-driven handpiece more powerful or less is literally the size of the head, the size of the turbine. The more the air is able to come in, the more speed it is able to generate, and as a result of that speed, it is able to provide us with that cutting ability. Now, one thing that a traditional air-driven handpiece does not have much of is torque. The traditional values, when we look at all the different handpiece brands that are out there, the average range for typical handpiece torque for air driven is usually between 12 and 18 watts, which basically we know is a very low number. And as a result, it means we don't have consistent power and we are heavily reliant on the massive amount of speed an air driven handpiece will generate. However, our biggest handicap that we find with an air-driven handpiece is that as soon as that handpiece burr makes contact with the tooth surface, 40% of our overall speed is actually going to be immediately lost due to friction and resistance. Now, this is massive because, again, for all of our air-driven handpiece uses and procedures that we use them for, we are relying on speed, and yet as soon as we touch that tooth surface, we are losing 40% of that speed, and that is why we try and utilize handpieces that have greater and larger turbines, because we can bring in more air and generate more speed. But ultimately, if our greatest asset is going to be 40% lost just through the process of friction, that's going to create a huge problem. Now, many of us, real quick, will identify with cases where we're trying to cut through a metal, for example, a metal crown, and we'll find it's really difficult to cut through and our hands are getting tired. And what do we oftentimes try and do? We try and put more of our hand power into it, thinking that we'll be able to generate more force, when in fact, all we're doing is we're creating even more resistance. That 40% number goes up even higher, ends up leading to all sorts of hand fatigue, muscle fatigue, and we aren't even able to cut through more effectively. So the take home with air is that we have always had this handicap of speed and not enough torque. And of course, that is why the electric handpiece, when it came in, had such a drastic jump in our ability to be more efficient and be able to cut through things quicker. The reason for that is that unlike the air driven, which relies on the turbine and the air that it is able to intake and generate speed, electric handpieces are gear driven. So the size of that head or turbine is completely irrelevant. These handpieces are made of just gears and guts. And as a result of this, they have a tremendous amount of torque. Now, we talked about that average air-driven handpiece range, usually roughly around the 12 to 18 watt range. Well, we can see that the electric handpieces in all of the different types that are out there, you'll find can reach upwards of 45 watts. So you're looking at literally a 3x increase in power. And so what that really results in for us in the chair, working on that patient, is that we have more consistent power. There is no resistance in terms of the surface with the speed. We can get consistent power all the way through, and that is going to save us a considerable amount of time, considerable amount of energy, musculoskeletal fatigue, which of course dogs all of us as clinicians. So we're able to simply do our job quicker and more effectively. Now, of course, there are many different companies out there. Some of these are probably familiar ones that all of you have used at least one or a portion of them over your careers. There's a lot of electric ones that are out there. The one I want to highlight tonight in terms of my bread and butter comes from NSK. NSK, I'm sure everybody's already well aware of their company. They're the biggest global handpiece company that's out there. And my bread and butter go-to is known as the Z95L. Now, the reason for this is that, first of all, in terms of overall power, that torque that we're going to be able to get is at the top of the list among the electric handpiece options that are out there. But at the same time, it is also the quietest in terms of noise exposure, which is another huge topic, something I've spoken about pretty religiously for the past 13 years. But in addition, it also is the lightest. So we talk about overall wear and fatigue. If you're cutting through crowns and bridges consistently throughout the day as a restorative, prosthodontist, pediatric, etc., this can add up over time. So we get the biggest amount of power with torque, with the least amount of weight. But in addition to that, we have a powerful LED light that is so strong that if I was to remove the light on my loop and my overhead light, I would be comfortable cutting through teeth for, in my case, extraction procedures or osseous procedures or whatever they might be with just that LED light alone. That's just how powerful that light is. So that really gives us a tremendous amount of added visibility. The other really unique factor, you can see this on that photo, it has a small little access pin that you can use a chuck to toggle, and it will help us toggle between water spray and water mist. So depending where in the mouth that you are working on, depending on how much visibility that you have and how much better access that you want to have, to be able to have that option to toggle between the water spray and the water mist is another very unique capability that this Z95 has, and is what makes it being the bread and butter for all of my surgical type procedures. Now, the further caveat that we wanted to make is not only have we seen advances in terms of what air can do and what electric can do, but there's this concept of where size can matter. And what do we mean by that? Well, this photo will help demonstrate this point very well, and I don't have to emphasize to anybody on this call, if you're having to prep the distal lingual of a number 18 or a number 15 or wherever in that mouth might be, or even trying to prep teeth and extract teeth and work on patients who have either TMJ or just anatomically really small mouths that they can't open very big. You all know how challenging it is, as if our job is not difficult enough, to try and finagle our hand and angle ourselves to be able to get into these very difficult spaces. For those of you, again, who work with a lot of pediatric patients, they naturally, of course, have much smaller mouths, but our job is still the same. So how can we help compensate for that? Well, a lot of the dental handpiece companies globally have started to identify this, and so they've actually started creating handpieces that are much smaller in size for the specific point of giving us better access and cutting ability. So the same line of electric handpieces that we just emphasized, having that greater amount of torque and providing us that greater amount of power and more consistent cutting ability, we can now actually adapt that into the smaller sized handpieces. And so to that same group, I emphasize a handpiece, again, from our colleagues at NSK, known as the Nano. So I emphasize this because I already highlighted their Z95L, which I mentioned is the lightest and of course the smallest on the market. But when you look at this Nano, it is almost 10 millimeters shorter and almost 4 grams lighter than already the lightest and smallest and most powerful handpiece electric that's out there to begin with. So you can see just how much smaller that handpiece can be. So for those of you who, again, we all have those patients that are going to have those tougher to reach areas, smaller mouths, TMJ, etc. When I have cases where I've got those patients that I'm just really having a hard time getting to, I can switch to the Nano. I will still have that same amount of torque power, but now my ability to, instead of having to contort myself and angle myself in a really more challenging position to do my job, I'm able to access those areas considerably easier and do a lot less fatigue and wear on my body as well. So again, from all companies, whether it's an NSK, a Cavo, all these different Midwest, the big names that are out there, you're all going to see that they are going to offer this smaller sized handpiece. So I really emphasize that. So from a high-speed standpoint, what we can appreciate is that when we talk about air-driven, we have tremendous speed, not a lot of torque, and we lose a lot of that power. With electric, we have consistent power. We now can package that power into yet a smaller sized, handpiece. But have anything evolved since then? Well, we're going to show you one thing that has changed the game. Now, when we talk about the electric handpiece, just to show you a quick example of why this makes such a tremendous impact. Again, for somebody like myself, this is me sectioning through a bridge. Typically with an air-driven handpiece, because of that greater amount of resistance that we get with the loss of speed, it will take sometimes 5, 10, even up to 15 minutes to cut through bridges. But you can see with this electric handpiece, in just a few seconds time, for me explaining to you what this video even is, I'm able to completely cut through and section through that bridge with ease without any extra fatigue or wear on my hands. So again, just an example of how much chair time that saves, how much wear it is for us. And of course, for patients who are chomping at the bit to get out of the chair, we're able to get through our procedures that much quicker. Now, the biggest, newest evolution with this high-speed technology happens to also come from our friends at NSK. I just emphasized to you how our biggest holdup with air-driven handpieces is that we do not have enough torque. Well, a lot of us who in practice out there are loving our air-driven handpieces. We don't want to switch to an electric. Either we don't have the space, we don't want to invest in the overhead, or we just flat out are stubborn and like our old air-driven handpieces. But again, we've been compromised by that lack of torque until now. So as I said, 3 years ago, what I explained to you now is completely outdated because in the past 6 to 8 months, we now have, believe it or not, a new air-driven handpiece line known as the Timax Z. And this product, this is an air-driven handpiece. We have the ability of torque ranges up to 44 watts. Now, if you remember, most of the electric ones on the market, their range is peaking up until that mid 40s. So what we're seeing now is that we actually have an air-driven handpiece that develops enough power in the same range as an electric. That is insane. That shouldn't even really be possible. And so as a result, we can use our air-driven handpieces, significantly cut down on the amount of chair time, still get that consistent power with those added benefits of the greater amount of speed. So again, when we talk about modern advances, what NSK has now done with this new Timax Z series is something pretty groundbreaking, where now we can hang on to our traditional air-driven handpieces and yet still get the same amount of power as we would with an electric. It's like having your Honda and still being able to outrace a Tesla that's out there on the road. It really is something that is defying what we would normally expect. So a really unique advance in some surgical settings. So I think from a handpiece standpoint alone, we already see a pretty cool advancement that's come in the last years, not only from a size standpoint, knowing that now we can go to the nano to be able to access some more hard to reach places, but again, from a power standpoint, we can match air with electric in the same conversation. So pretty amazing there by itself. Going to transition from handpiece to talk a little bit about surgical technology. Now, myself as a periodontist, of course, I'm going to be a little biased in terms of some of the things surgically that I'm going to discuss. And one of them that I think appeals to all of us on this call are going to be implant motors. And implant motors, there are tons of different types that are out there. Some of the more traditional ones you're seeing up here on the screen, I have had and owned and had experience using all of them. In fact, that top left one, that green W&H motor, was my original motor I purchased almost, 16 years ago now upon finishing residency. So these are all motors that I have direct experience with. But what we're going to find is that there are pros and cons with each different systems, and there are some specific qualities and traits that you will want to look for when trying to decide which motor to invest in. And up until about 2 years ago, my W&H was still kind of my go-to, but that shifted over time once I began using what is known as the Surgic Pro motor. And what made the Surgic Pro motor such a game changer for me as a clinician, and this was something I've highlighted over years in some different dental publications, including this one in Dental Product Shopper, is that first of all, one thing that's really unique as opposed to my other motors that I had is that I have multiple program preset options. So with the Surgic Pro motor, I have up to 8 programmable presets. Now, where that could come into play is that depending on where in the mouth I'm working, how cortical or cancellous that bone is, and the different type of conditions I'm working in, I can basically preset different types of settings, which again, in the chair can save me time and allow me to adapt to what's going on in real time as I'm doing the procedure. So this is something that's very unique. But ultimately, for me, what makes any implant motor so important and what made this such a game changer for me is just how smooth the operation is. At the end of the day, when you're going to be placing an implant, especially for those of you who try and do immediate implants within extraction sockets, having less chatter and being able to really be precise in terms of where that drill is going to be essential. The amount of friction created, the heat generated, and the amount of chatter, a small amount of movement, it can completely change the angulation and the direction of your implant placement. So to have an implant motor that is very smooth in terms of delivering consistent power on the drill, not creating chatter and movement through the drilling process is very, very essential. And I had yet to find a motor that is providing a smoother operation than that. The other things I'm going to highlight in the next slides are going to be the concepts of controlling saline flow and this massive topic of torque. So that's going to be coming in just a second. Some of these examples in terms of the presets that I'm showing you, again, depending on whether I'm doing the actual implant placement or I'm doing the actual typical osteotomy preparation. Again, with my W&H, along with some of my other motors that I had at other practices and used over time, I did not have that ability. Basically, everything is set at one fixed RPM. So if I'm working in, again, bone, that is again far more cancellous or cortical. I'm not able to kind of toggle back and forth. I'm continuously having to stop, go, and make adjustments. So it does make a difference over time, and it has made an impact of me being simply more efficient. We're going to talk about the reverse settings in just a moment, so hang on to that for a quick second. The other aspect, really ignored, but something I think that has come to hound me and create more challenges for me during implant placement, believe it or not, is the water connection. So we're all probably pretty well familiar with our typical green water hose on the right side. And what we find is that a couple of different things with the different motors that are out there. Up until only a few years ago, some of the other motors that were out there did not even allow us to control the flow of the saline that was coming out. So it would just basically be either the water is on or it's off. But being able to control the flow, again, based on where in the mouth you're working on, based on how your visibility is, based on if it's an area where it keeps making the patient get water back there easier because of the angulation that they're seated at. Being able to toggle that water control is something that's really important. We've seen some motors like the newer W&H motors being able to provide different water settings for the amount that is going to be coming out of that, which is fantastic. Very few motors have adapted that more. Some of them are still stuck in the old way. So that's another quality that I always look for. But when we talk about the actual physical connection, keep in mind that our traditional kind of green tube that we have has that kind of, I call it the roly-poly type of connection in terms of being able to determine whether or not it is being crimped to keep the water from flowing versus allowing for free flow. So on the right side, we see our traditional green tubing. We've got our little red Pez dispenser roly-poly type of thing that we roll with our thumb. And what has happened far too often to me is that that is really easy to start, because of the pressure it puts on there when you tighten it, to start crimping that overall tubing. And what ends up happening when you start crimping it is now you start affecting the water flow. So you start having issues of water not coming out at sufficient amounts, which can then, of course, lead to greater heat generation. What you find with our Surgic Pro motor is that the way the tubing is designed, rather than having a rolling crimping type thing, there is a simple click type of attachment that's there that you can see is just as simple as just clipping on and off. So the amount of force and the amount of overall crimping it's putting on the tubing is significantly less. So I'm not having those same problems of having situations where my water flow is being diminished in any degree because of that. And again, it sounds like a small factor, but it's one of those things where you're going to have a case where it starts to create more stress and you having to go back and forth and having to play, or maybe even having to change your tubing because it's affecting your water flow. So little things like that make a very big difference. And we now have the ability with our foot pedals to be able to toggle, if you do have a motor that allows you to control the amount of range of what that saline flow is. We can do that via the foot pedal, but again, that connection at the hose level is what is going to help us make sure that we don't get any backlog. So the big topic that I wanted to mention with any of our implant motors is the concept of torque. As we all are aware, when we go to place an implant, the general traditional number that we look at for overall stability is roughly around 35 Newton centimeters. Now we can toggle less or more as needed, but what you're going to find is that almost all of the motors that have been on the market, all the ones that I've had in the past, they max out at a torque of 50 Newton centimeters. Now, where that can come into play is really critical, especially at times of needing to use reverse torque, and I'm going to highlight that in a moment. Now, what's so important and so useful with that Surgic Pro motor is that rather tapping out at that peak of 50 Newton centimeters, they allow a range upwards of 80 Newton centimeters. So having an additional 30 Newton centimeters of torque power when we're doing these procedures can become a literal game changer in your overall surgical cases and conditions. One of the most common conditions you'll find is a situation where you need to do reverse torque. And having taught implant courses a lot of times, there's a lot of earlier clinicians who come down and talk about situations where the either did not drill appropriately according to protocols. Maybe they tried to undersize because they were trying to develop more primary stability. And all the point being is that what can happen oftentimes is that if you have a bone that is either very dense or implant that maybe is not very self-tapping, if things are not made perfectly in the osteotomy, that implant will torque out before it is fully seated. Now, what ends up happening is depending on the amount of torque that it torqued out at, typically what will happen with all of your implant motors is that you will hit a reverse. It only has a maximum of 50, and in many cases, if there was a lot of torque in order to get that implant to torque out to begin with, even going up to 50 to try and reverse is not sufficient. So now you run into the problem of literally having an implant that is only partially seated, that you don't have enough torque to then be able to reverse it. And what happens sometimes is that you will say, well, let me just grab my torque wrench. But depending on the system you're using and the torque wrench that you have, your torque wrench may not be enough. And in some cases has even resulted in stripping or breaking apart within the inside of the implant. So point being, with the Surgic Pro, having that ability to get upwards of 80 Newton centimeters, this has given me tremendous peace of mind because I know I'm never going to be placing an implant upwards of 50 in torque and above. So I always know that I will have a big buffer zone of extra power. So even in the craziest situation, for whatever reason, if my implant has gotten stuck in there and that bone is very dense, I always know that I'm going to have that extra buffer zone of power, of torque, that I will be able to know that in any condition, I can still be able to reverse my implant and then go back and make my adjustments to my osteotomy. So the amount of peace of mind that this will give is tremendous. Now, has this been a situation I've had to use on a consistent basis? No. Hopefully, none of you will have to do this on a regular basis. But as all of you know, it's that one time or those few times that it comes up that you are going to be kissing the floor, well, really kissing the motor, for it giving you that extra power, because those are those scenarios where you're trying to smile to the patient, but you're starting to feel that sweat coming down and you're thinking, holy cow, how am I going to get out of this pickle? So having that extra power is a lifesaver. Again, all of my past motors, many of those motors you'll find on the market just aren't able of reaching that 80 Newton centimeter zone. So I would always say, if I'm going to be investing into that motor, get something that is going to be providing me with that extra power. That's something that makes a big difference. Now, one of the things we talk about from an evolutionary standpoint, one of the things that has driven me nuts is the fact that all of the motors, of course, have a foot pedal that is attached via a cord, right? That cord goes and attaches to the back of the implant motor, regardless of what system you're using. And so ultimately, we are limited based off of where our motor foot pedal is able to reach. So depending on where in the mouth that you're working on, of course, whether you sit, whether you stand, what quadrant you're in, depending on that surgical situation, the reality is that we get into this situation, and this is showing different motors. This is our W and H on our lower right. where we've got that foot cord there. Ultimately, the amount of distance that we have is limited. And then you can see in some of these situations, here I am, for example, trying to sit myself in a better angle to get better direct access to make my angulation better for my implant. But as you can see, that cord is pulling there. Now that's straining my ability to access it. And now I'm having to extend with my foot one way, contort my body another way. It ultimately adds to more challenges. And all of these motors that are out there have had this issue. And so what has really evolved in terms of technology is now we have a new version of that same Surgic Pro motor that we just discussed. Just came out in the last year. I actually had the first version of it in North America to test, known as the Surgic Pro 2. And we're going to discuss how, among other things, that challenge with that extending foot has been solved. And so this is another giant step forward, I would say, in terms of our ease from a surgical standpoint. It is one less cord for us to trip on, one less thing for us to take into for a factor. And ultimately, when we're doing our more challenging surgeries, one less thing to have to stress over just makes our life that much easier. So what we find with our new Surgic Pro, not only is it a lighter motor to set up and move around and carry, which is of course just a great thing to have, but at the end of the day, when we look at the overall length and weight, compared to some of our other motors that are out there on the market, we have something that again is shorter, weighs even less. So again, we talk about that wear. And believe me, when you're doing immediate implants and multiple implants and you're going back and forth and using it, being able to have a handpiece that is less weight, that is better balanced, and is even shorter in length is being a big factor in helping us with our surgical procedures, being able to get into those areas and do things more effectively. So having that is a big help. The center of gravity has actually shifted a little bit, which again, in terms of overall balance and how much extra force I have to do to keep the angulation of my drill in the exact position that I need. Again, I don't have to fight that center of gravity as much. So again, these are all very small details that are easy to overlook, but over time, and especially in cases with multiple implants and multiple back and forth and switching drills constantly and having to go back, these small things actually make a pretty big impact over time. The other unique advancement, though, that we have now that we never have had with any of our other motors that are out there is that we actually have wireless extensibility. So we can actually utilize Bluetooth technology to be able to now create the situation where our foot pedal now is completely wireless. We no longer have a big dangling cord. We have plenty of them in the room, but now I have one less thing to have to worry about. And my overall access from a Bluetooth standpoint goes beyond just the foot pedal, where now what we are able to do for those of you who like to test your implants to see what the overall ISQ measurement is to measure your primary stability, whether you're in a DSO or if this is for a referring doc, and you want to provide them as much info as possible. All of this data now, due to this wireless Bluetooth capability, can actually be stored on the cloud. So whether it is all of your implant measurements and presets, again, your overall ISQ rating, all of these things can be stored. So again, if you are doing a lot of referring and working with multiple clinicians, again, you're trying to provide that clinician with as much data and information as possible. These are all things with the Bluetooth technology we can now provide without having to have extra gadgets, extra gizmos, and more overhead and more work for ourselves. And I apologize for those of you who are Blue Jays fans, but being in Southern California, watching that game, Game 7 just the other night, what an incredible ending. And we all, for those of you who saw how razor thin that margin came at home plate, I emphasize yet again how big of a difference the foot pedal makes to not have the cord. This actually is what I would always feel like in many clinical situations where we just don't have enough cord length or it's at an awkward position. I'm having to stretch more than I'd like. Well, we talked about the overall advance in this technology and what we have now. is a traditional foot pedal similar to all the other ones we've used and seen in the past, with the difference now of not having any wire there. So you can see in this case how I'm using it. I can literally grab my foot, I can adjust it anywhere that I want. So regardless of where I am in the mouth, I can literally center that pedal to the area where it provides me the most comfort and best access into my patient's mouth without having that cord. So again, it sounds like a small detail, but it's one of those things that once you have it, you start having that feeling of hallelujah, where was this all this time in the past? And it's one of those things where if you've ever been on a domestic flight and for whatever reason they just upgraded you to first class and you're like, wow, these seats are better and I'm getting bigger peanuts and chips as opposed to nothing. And you're thinking, well, shoot, I want to do that again. And so having this wireless foot pedal is another advancement that really has made a big difference. And it's something, again, that motor is able to provide for us. So small things, but you start adding in the extra 30 Newton centimeter range of torque. You start adding in features of Bluetooth for those of you who are very tech advanced and like having all the ability to do things wirelessly. And you combine that with that smooth operation and the added LED light that it has. At the end of the day, we start seeing that these qualities add up and really provide us a comprehensive motor that really gives us kind of the best of all worlds. So I still have my old W&H always as a backup, but after having experienced this, my Surgic Pro 2 is hands down my go-to when it comes to implant motors. So within that surgical space, we talked about implant motors. The other type of big surgical motor that you'll find out there is the piezo surgical unit. For those of you maybe not familiar what we're really doing with piezo surgical units, think about doing things like sinus lifts. So when we do a sinus lift and we create a window, as you can imagine, that Schneiderian membrane is extremely thin and delicate. So when we get close to reaching the base of that membrane, going with a traditional burr to try and access that window, it's very risky. It takes a very small amount to create a large perforation. And so what we like to do is with piezo technology, we can very confidently go and cut that very thin amount of remaining bone without the fear of creating perforations. And so it gives us a tremendous amount of peace of mind. Another thing that piezo surgical units do, for those of you involved more in more advanced type of surgical procedures, is you can do different things like ridge splitting procedures, where we can actually create and expand the width of the ridge rather than going through a more traditional kind of a gum grafting augmentation procedure. If we have a wide enough base to the bone, we can quote unquote split that ridge, create a greater amount of space where we can then place our implant and graft around. And the long story short is that these piezo technology units allow us to do these procedures with not only a tremendous amount of precision, but do it in a way where we're not damaging and overheating the bone, and being able to take very thin areas and do them very precisely. Because even a procedure like this, you can appreciate on that lower photograph, if we were to not use a piezo and try and use whether it be hand instruments, hand chisels, or God forbid a traditional handpiece, your ability to do such a fine cut and split like that, it simply just would not be realistically possible. So this really allows this extra level of precision. So this just showing you a quick clinical example of what that ridge split looks like, where we'll be able to widen an otherwise ridge that is too narrow, place our implants and graft all around it. Now, usually what you'll find with these piezo units, they come with a set of different types of burrs. Each burr creates a different type of function. Again, whether you're doing more of a ridge split, whether you're doing more of a type of a sinus window creation. So depending on the procedure you're doing, you'll find that you have different types of attachments that are there and that are accessible. Now, in our family of these piezo units, one is known as the VarioSurge, and basically I highlighted to you the example of when we're creating that sinus lift window, where what we'll do is that we'll start with a more traditional handpiece. This is an electric handpiece, again, giving us that greater amount of power. You'll be able to appreciate the LED lighting there. But what ends up happening is that we will start to create our window with a traditional burr. But as you can start to see, when we get from the point on the left side to our photo on the right, now we're at the area where you can start to make out that blue hue of that Schneiderian membrane. So for us at that point, to go back with that same high speed and burr, the chances of us creating a perforation are considerably higher. So instead, what we end up doing is we switch to our piezoelectric, and with our piezo, we can go around that razor thin area of bone that is left separating itself from the membrane. And that piezo technology allows us to be able to remove that very fine amount of bone without the fear of perforating the base of that membrane. So again, in these very delicate, very hard to reach areas with very thin access, having that piezo for that peace of mind is really essential for doing these types of procedures, and again can result in us being able to create our full sinus windows without worrying about our perforations. This is just showing you the after for the sake of showing what these sinus lift procedures look like once we fill those in. So really the take home is what we find is that those piezo units can make a huge impact, and what we now have seen is that the same unit with our Surgic Pro that we can use one foot pedal that is wireless, bring in that Bluetooth technology as well. The same is going to be the case with our VarioSurge Piezo Electric, where we're able to incorporate the same type of Bluetooth technology, the same kind of footless pedal, all in one unit. So it is pretty unique to see what's coming. So I think take home wise, from an implant motor standpoint, the thing I would say to everybody, regardless of if you're going with a W&H, a BN Air, obviously the NSK ones I highlighted, try and emphasize the fact that you have multiple different zones of saline flow control so you can control the amount of water flow that's coming. Take close attention to your ability of what your maximum torque is, so you can hopefully have that. And again, if you are like me, really kind of interested in having that footless pedal control and those multiple presets, well, we know that the Surgic Pro would really, in that situation, help us steer towards that type of a motor to give us that better overall result. The last area of surgical advance that I want to talk about has to do from the maintenance side. Now, maintenance is something that is always greatly overlooked. We always think about surgical procedures, about how we're diagnosing things, how we're doing things from a digital workflow standpoint in terms of setting up the case. Of course, we've got the surgical execution. We talked about some of the motors and piezos and what we're doing clinically in the mouth there. But usually what happens is once those procedures are done, especially in the implant world, we usually lose track and don't really have a good system and protocol for managing our patients over time. And so we're going to talk about one of the big layers of advancements that comes in terms of change over time, and that has to do with airflow technology. Now, airflow technology is not something necessarily new to the field, but it too, just like the air-driven and electric handpiece world and the implant motor world, has also evolved and drastically improved. So we'll talk about some of the ways that things have shifted and improved, and discuss again why we would want to utilize this technology and in what clinical situations that we'll want to utilize this technology. Now, on this first photo, you can see that I'm demonstrating two different type of airflow units for you. But one of the things you'll also appreciate is that in this photo, both of those units come from the same company known as EMS. I highlight EMS simply because when it comes to the airflow world, they are the most established household name that if you know anything about airflow technology, this will have been the company and the product that you will likely have heard of. So EMS, they have a very defined protocol known as the GBT protocol that they have for hygiene in terms of being able to use airflow technology to manage cases. We're not going to get so much into their specific protocol as opposed to discussing what the technology is and what makes it really unique and important. So what the big kind of claim to fame with this airflow technology is, first and foremost, is overall patient comfort. So when we think about what we can do for airflow technology, think of from a hygiene standpoint, your traditional scaling and root planing procedures. Obviously, the goal of your hygienist is you have a patient that has been diagnosed as having periodontal pockets. They may have a lot of inflammation, bleeding on probing, heavy calculus deposits, whatever you want to name, and or they have a lot of staining. And what ends up happening now, it is hygiene or the clinician's role to go in there and to try and remove and disrupt as much of the biofilm and the plaque and remove all the calculus from the surface of the tooth. But what we all know is that it is not a very fun thing to do. For those of you who still utilize traditional hand instruments, I don't think I have to say much because probably just this discussion is making your wrists sore just thinking about it. But we know that it takes a lot of time and effort, even with advances now using ultrasonic, cavitrons and piezos to try and clean teeth. Yes, they are certainly more efficient than our traditional hand instruments, and we found that they are very effective as well. However, what the literature has been very supportive in finding universally is that when we compare airflow technology to the ultrasonic, our ability to effectively disrupt and break down and remove the negative biofilm that we're trying to fight off and being able to clean these areas, we're able to do it far more effectively and far quicker with the airflow than we are with hand instruments and traditional ultrasonics. So one of the big things of the benefits is that we're able to do the same procedure in a considerably quicker amount of time. So from our standpoint as the clinician in the chair, we're going to save a lot of chair time. But the big thing, and probably the biggest of all, is what our patients perceive. As we all know, patients do not look forward to having scaling and root planing. You hear patients come in after they've had a quad or two of scaling and root planing, and they're sore. They talk about a few days of discomfort, some post-op sensitivity to cold water and sweets, right? Because of the layer that's being exposed from using our hand instruments. And you hate having patients say, do I have to get scraped again, right? It's all about that patient experience. Well, with airflow technology, we can remove that plaque far more effectively, but the patients don't have any discomfort. So if you're using airflow and you're doing a quad of SRP, your patient's going to come back the next time and say, I didn't feel a thing during, I didn't feel anything after, I wasn't sore the next day, I didn't have that sensitivity. So it's going to be far more patient friendly for the overall experience, which, as we all know, is the name of the game. You know, they're going to go and give a 5-star review because they're going to say, hey, I did the procedure, but this time it wasn't being scraped and it didn't hurt, right? In addition to that, for your patients that have a heavy amount of staining, either they are smokers, they drink a lot of coffee, you've been prescribing them chlorhexidine, which I would tell you a different topic is you need to stop doing that. But you'll see with patients that have significant amount of staining, the airflow technology is going to be able to remove that staining considerably quicker with little or no energy. So in a very shorter period of time, we're going to be able to do our job significantly better. And what we find is that both with the supragingival, and we're going to talk about the subgingival in just a moment, we can very comfortably and very quickly work our way around the patient's arch. And with these patients that have, again, staining like that, in a very quick period of time, quickly and effectively and completely painlessly for our patient, We can wipe away that staining while still being very effective in being able to remove that plaque. Now, with calculus that is very, very dense, is really hardened and established, keep in mind that the airflow on its own may not completely remove that extremely stubborn calculus, but by cleaning the rest of the surface around there, it will provide you better visibility for you to be able to get in there and quickly remove those isolated areas. Because keep in mind, another big challenge when we're doing these types of procedures is we'll look radiographically and we'll say, well, I can see something there, but clinically, I'm looking everywhere and I'm doing everything I can and I just can't find it. Well, this will also help you better visualize where that calculus is located. And we're really talking about that firm, hardened, established one. The looser, softer calculus will get wiped right off. Now, there are different type of supragingival units that are out there. I obviously highlighted EMS off the bat. They're the biggest one everybody knows. Just know that there are other ones that are out there, like this one known as the Profimate Neo from our colleagues at NSK, the same air polishing system that is out there. And the way this works with the air polishing is that the actual powder that is going and doing not only the stain removal, but removing that biofilm is known as glycine powder. Now, glycine powder is a very tiny particulate. It has been found to be, again, not only very comfortable, but the whole point around the glycine powder is that it is not very abrasive to the surface of the tooth, and it has been very effective in doing all the things that we said. But when we talk about evolution, over the past 5 years, what has happened is that glycine powder has actually been replaced by a new powder known as erythritol. Now, for those of you who love coffee and love to use artificial sweeteners, erythritol is probably something you've heard of because it is what is in your Splenda. Now, why the shift has been made with erythritol is that in comparison to glycine, that actual particulate is even smaller and even less abrasive than glycine. So now all these air polishing units have been switched primarily to erythritol because now you've got something that is even a smaller particulate, less abrasive, and again, it will allow you to do your job even quicker. Now, where this is really taken off in the surgical space and why we mention this is that over the past 10 years, this has really been a tip of the spear type of treatment when it comes to dealing with peri-implant complications, whether that be peri-implant mucositis, which similar on natural teeth, think of it like gingivitis, where you start getting bleeding on probing, inflammation, and just signs of overall potential starts of complications around that implant, or for more established peri-implantitis lesions where now you actually have potential suppuration, bone loss, thread exposure around the implant. There is an entire market, a billion-dollar market out there in terms of trying to manage and clean out these biofilm and bacteria that are subgingivally around these peri-implant areas. And up until pretty recently, this air polishing option has really been tip of spear treatment that we're able to go in and be able to use this powder around our implant sites. And as a result of doing it, we're able to disrupt that biofilm. We are able to clean the surface of the implant without, again, because of the small particulate size and the non-abrasive nature, we are able to do that up around that implant surface without damaging the surface of the implant. So it's part of what has made this air polishing so significant. So as I highlighted, when we look at the literature that's out there, of course, I'm just showing you one example because of time. When we compare the use of air polishing in comparison to things like hand instrumentation, ultrasonics, using things like carbon fiber curettes, sponge floss, a lot of the different type of options that have been traditionally used in trying to manage implant plaque and biofilm accumulation. The air polishing has been found far and above to be the most effective. And again, we know it is the quickest and easiest to do. So one of the questions then becomes, how come this hasn't been adopted all over the place? Well, this sounds like it's quicker and easier, which it really is. But one of the big things that we see, and this just highlighting again, the fact that how significant of a problem this is in the implant space, being that these peri-implantitis cases are now happening in over 1 in 4 of every implant that is placed in the US population. And now these numbers are unfortunately just going up even more. So again, these non-surgical management options, air polishing being one of them, have come to the forefront that much more. But what I was mentioning is that one of the reasons why these technologies have not maybe been adopted as often, there's two things to them. Number one, unfortunately, has been the cost. Obviously, all of us as dental professionals have to deal with overhead management. And we just talked about things like investing in possible new handpieces. We talked about surgical technologies. You obviously have all of your other equipment and all of your other gloves and all the other things you have in your practice. So we've got a tremendous amount of overhead. And unfortunately, even though this EMS unit has been the most traditionally well-known and respected name that's out there, it has been very cost abrasive, let's say, excuse the pun here, in terms of being adopted. This unit can range roughly between a range of $12,000 to $15,000, which, depending on the type of practice you have, I still feel is a worthy investment. But certainly for a lot of practices, they're like, hey, look, this is way over our head. And so that is one side of it. The other side that has made adoption a little bit more challenging is the simple fact that there is a lot of maintenance involved with these units. As you can imagine, there is, again, these particles, these erythritol or glycine powder particles, are very, very small and very fine. So when you look at a unit like this, in terms of the powder needing to run through the actual unit, this is something that is separate to the chair. You can see is being rolled in on its own unit. So between the handpiece, between the tubing, and all of its individual parts, you have to do a lot of maintenance. So that requires a lot of cleaning, a lot of management, a lot of maintenance, so things don't get backed up and you don't have complications for the unit. So that has been one thing from the airflow side, I would say, has been a little bit of a challenge. However, what is really great and another new advancement, brand new off the market, this is only a few months in, our colleagues from NSK have created a subgingival air polishing unit known as the PerioMate. It is literally doing everything that I just showed from our friends at EMS, but what makes this so unique for me is that rather than this being an entire separate unit like the photo we showed before, where from an overhead standpoint, now you have another unit that you have to wheel in and wheel out and manage. As you can see on this PerioMate at the end, you can see that that connection goes right onto your regular handpiece connection that you have already set up in your room. So rather than needing an entire unit, you simply just have the PerioMate handpiece that literally latches right onto your direct connection, very compatible with all the different couplers that you might have. They send you the coupler again that comes onto it, so it will attach right on. You simply put the powder into that globe that's there, and you're ready to go. And so for me, testing this unit out, you can see it just looks like I'm using just another typical handpiece, but in fact, this is the air polishing unit, and you can see this is me treating this implant that is exhibiting signs of peri-implantitis. It has that very long but very flexible rubber tip there that is helping me get underneath that pocket and access it very comfortably. And between the water spray and the powder, I'm able to, again, emit that air polishing powder in there and be able to manage the overall peri-implant standpoint. So very unique that we can still do air polishing, not have to bring in another unit. And I can tell you, I don't know exact numbers, but I do know in comparison, it is literally a fraction of the price. So now I have something that is very affordable that I can literally put onto my existing handpiece unit in any room in my office. And so this provides me with even more flexibility and more options. So with that being said, I tried my best in a very short period of time to go over a lot of different surgical technologies and advancements that have come. Understand that as we see all these evolutions that have occurred, we've seen advancements in high-speed technology, where now we have handpieces that are small that can help us access difficult to get to places. We have electric units that provide a significant amount of torque, but we now even have air-driven handpieces that have the same level of torque of what we find for electric. In terms of implant motors, as I highlighted, look for torque, look for ability to control water flow, pay attention to the overall tubing that you have, and know that the wireless foot pedal, but most importantly of all, that extra range of reverse torque is a make or break for any motor that you're looking to investing in. And again, with non-surgical advancements, it is worth investing in airflow technologies for everybody, but being from the cost and overall management of a big unit, having this new perio-mate that will attach directly on has also made a big impact. So with that being said, in a very limited amount of time, I always get questions about equipment and what we do in surgery in terms of different systems and products, some of which we just highlighted here tonight. So I invite all of you. This is a completely free resource. I've provided a list of every category possible and different types of products and options that are out there, from scalers to implants and on and on. So feel free to scan that and have that access. Again, as mentioned, I will stick around as long as possible. I thank you all for taking an hour of your time. I hope I was able to introduce some new technologies and some uses for them. Please feel free, of course, to follow me on social media so we can connect further. And thank you again so much for your time, and I'll stick around for any questions. Okay, I'm going through here. Couple of different questions that I'm finding here for everybody. Okay, so first one in terms of, oh, well, one question is regarding electric handpieces and overall cost. Certainly when electrics came out, you can imagine like anything else, when they were new, the cost was much higher. Because they have become more common now, I think you'll find that those costs have really evened out a lot more. I can't tell you a specific cost, number one, because of course every brand is totally different. And I don't know what one, charges versus another. But what I can tell you is that now I think one of the things we're going to find once this new air-driven line of handpieces that I highlighted by NSK starts to come out and more people start to use it, it's also, in my opinion, going to change a little bit of the market within electric, right? Because now people are going to say, well, wait a second, I can get air-driven. I don't need the electric. So the electric crew is going to have to start figuring out something dynamic. So I see some of the ways that is going to change. So it's really interesting for that. Another question here asking about that nano handpiece that I showed in terms of the overall diameter and how is it versus the Z95, the electric that I showed out. Yes, what you're going to find with that is really the difference is in overall the length and the weight. So the overall head diameter, the torque, all of the rest of that part is going to be the exact same, but what you find, again, it's roughly about 10 millimeters shorter and about 4 grams lighter. So really, it's just more the accessibility for you as a clinician to be able to get that ready. So in terms of the Nano, again, of all of the different brands, Cavo, Midwest, as I showed on that one chart, they are all coming out. They have all come out with their own version of, we'll call them a reduced sized electric handpiece. But I highlighted the Nano because, again, out of all of them that are there, it is the lightest one. It has the most torque. It emits the least amount of decibels. So it, again, has that best all around type of service that's there. So that is why I'm mentioning that. One more quick question. What is the speed of your electric handpiece when removing bridges? Great question. I tried really briefly to show you one video of that. I think you saw in that video as I was sectioning through that bridge, I think that was maybe 12 to 15 seconds of me talking by the time I cut through. So that's literally how much time it takes. Doing that same procedure with an air driven, I would have gotten through it eventually. There's no doubt about that, but it would have taken me definitely a lot more time and it would have created a lot more musculoskeletal wear, which is again why I mentioned that. Another question asking, do I have patients insisting on hand scaling versus Cavitron? I would say I have more patients insisting on none of the above, right? Nobody likes that feeling of hand scaling or cavitrons, which is why the air polishing option is of such appeal because the patients you will find will simply not complain about it because it doesn't hurt, it doesn't cause post-op sensitivity, you're able to do everything quicker. So from a patient satisfaction standpoint, they are going to be jumping at using an airflow from the clinician and from your hygienist standpoint, you as well are going to be much happier as well because it's creating a lot less wear and tear. You're just taking that airflow polish around the area and it is literally doing the work for us. So you'll find it to be very, very effective in terms of what it's able to do. Question is there a reduced risk of introducing air into any potential soft tissue spaces because of electric? It's a good question. I think ultimately, again, electric being more gear-based and providing that consistent power, yes, you don't have that same level of air being, kind of expelled out there because of that. So I do think you will have a less overall risk of that. In addition to that, I think I showed you that toggle between the water mist and the water spray, which it can also be, again, really important both from a visibility standpoint, but also from the patient experience in terms of sometimes if you're working on a back tooth, they keep gathering up water and choking, and you have to stop more often despite your best job of suctioning. So that can really make a big difference. Another quick question. What are your thoughts on burrs to use on electric? Are they different than air driven? Great question. I would say to you, because of the consistent power, I don't really need to change the type of burr I need to use. So let's say, for example, in that video where I showed sectioning through that bridge, I'll try and use an aggressive diamond burr, again, depending on the actual material and the metal or is it zirconia, what am I cutting through? But it really isn't that I would change the burr. It's just that because of the consistent torque that the electric handpiece is providing me because of that constant power, it is just able to, that same burr that I would put on the air driven is just able to do the job significantly quicker. Now, of course, like I said, that might change now because of the new Timax. So it's worth reaching out to a local, NSK rep around you and asking them that same question now that they have that higher powered air driven that you'll find. So, you'll see what that might be and see how that works out. So last question here that we have is asking what is the normal torque and speed that you'd use for routine oral surgery like sectioning teeth and bone removal. So not really a set torque or speed in terms of doing a tooth extraction because that I would just be doing with my traditional handpiece that I'd be doing. What you'll find on the electric units is that, well, again, depends on the company. But I think for the NSK electric motors, I think they have a torque out, I think it's 20,000, I want to say is the number. Don't quote me on that. But point being for this is that, again, with the electric, they already have a set power that it's going to consistently give you. So I'm not worried about that relationship of torque and speed when I'm using that. Where the torque and speed come directly into account and really make an impact is when you're talking about implant placement. So if we shift gears from the high-speed handpiece and we focus on the implant motor that we discussed, whether it's your W&H, whether it's your Surgic Pro or the Surgic Pro 2 that I highlighted, that's where things change because you actually, in those cases, have the ability with the Surgic Pro to toggle and customize with the presets what type of torque and what type of speed that you use. And obviously, depending on your implant drilling protocol, I think the most traditional that you'll find is that during the drilling and the osteotomy, most traditionally you'll find a range of around 800 to 850 for the RPM that you'll find on there. And then torque for your placement, you're typically placing those implants in that range of 30 to 35 Newton centimeters. That being said, I've seen clinicians that are a little bit more conservative and might do less, and some that do more. But keep in mind, part of the nuance with that is that if you are trying to be a little bit more aggressive to get more primary torquage and get that down, if you have a site that's very dense and that implant torques out, if your max is 50, a lot of times you're just not able to do that. So that's where that comes into play and where that 80 Newton centimeter makes such a big impact. So I think my time just ran out, so I hope looks like I answered every question that was there. Please, again, keep in touch via social media. Feel free to reach out. I hope we all were able to benefit from this course. And again, thank you all for your time and your attention tonight. And I look forward to connecting with everybody again soon. Have a great night.